Hello, and welcome to the COVID-19 School Health Webinar. This webinar is a joint collaboration between Pinal County Public Health Service District and the University of Arizona Mel and Enid Zuckerman College of Public Health as part of the Academic Health Department collaboration. Special thank you to Dr. Mariana Casal, who is the Infection Diseases Epidemiology Surveillance Division Manager at Pinal County Health Service District, for her support in developing this webinar. My name is Aiden Grijalva.
And my name is Erin Kenny.
And we are both interns for the MEZCOPH Academic Health Department. And today we will be jointly presenting the COVID-19 School Health Webinar. The learning objectives of this webinar are to explain how COVID-19 benchmarks impact school mitigation strategies in Pinal County, describe Pinal County's health district's guidance for schools to prevent and manage COVID-19 outbreaks, and to identify 3 COVID-19 vaccines and debunk vaccine myths. Many of you participating in this webinar are teachers, parents, and school administrators. We hope this webinar answers your questions and gives you some sense of what to expect in the future. Let's start off by talking about what COVID-19 is. COVID-19 is a respiratory disease that spreads from person to person through respiratory droplets that are produced when one who is infected coughs, sneezes, or talks. Some people can have COVID-19 but experience no symptoms. That is known as being asymptomatic. These cases can still transmit the disease. People diagnosed with COVID-19 may experience symptoms such as fever, fatigue, shortness of breath, loss of taste and smell, or others. In severe cases, people can experience respiratory problems, organ failure, or even death. Children and adults with underlying medical conditions are at an increased risk of severe illness. Keep in mind that this is a new virus and is still being researched every day. Multisystem inflammatory syndrome, known as MISC, is a condition when a portion or portions of a child's body becomes inflamed, including the heart, lungs, kidneys, brain, skin, eyes, or gastrointestinal organs. This is a serious syndrome and can be deadly, but most children can recover through medical care. How does MISC relate to COVID-19? Many children with MISC had COVID-19 or were exposed to COVID-19. Even though not all children will develop MISC, the risk increases with the exposure to this disease. Some symptoms to be aware of for MISC includes abdominal and neck pain, rash, bloodshot eyes, new confusions, inability to wake or stay awake, and having pale, gray, or blue colored skin, lips, or nail beds, depending on skin tone. It is important to remember that if your child has symptoms or becomes very sick, please seek medical attention right away. As communities plan safe deliveries of in-person instruction in K-12 schools, it is important to understand how schools should operate safely. CDC created the operational strategies for K-12 schools through phase mitigation guidance, which presents updated indicators and thresholds for assessing the level of COVID-19 community transmission and corresponding recommendations for mitigation strategies, learning modes, and COVID-19 testing. This is an evolving document. Depending on new information, CDC evaluates and updates. This image reflects the COVID-19 school benchmarks. We can see each category and what it represents in the chart below with 2 main indicators: the total new cases per 100,000 persons in the past 7 days, and the percentage of NATs that are positive during the past 7 days. NATs is a PCR test to detect viral RNA. Pinal County utilizes the CDC guidance to make decisions on reopening schools for in-person learning and implementing mitigation strategies. Here is an example of school benchmarks for Pinal County. When the transmission levels is substantial, as shown both Arizona and Pinal County on this slide, this means that there has been a total of 55 to 99 COVID-19 cases per 100,000 persons in the past 7 days, and the percentage of positive tests during the past 7 days are between 8% and 9.9%. In this example, we can compare school districts and their COVID-19 transmission levels. 5 of the 8 school districts in Pinal County are in the substantial category, but we can see that Coleridge and Mammoth San Manuel Unified School District are moderate categories. This means that there are 10 to 49 COVID cases per 100,000 persons, and 5 to 7.9% of tests are positive. J.O. Combs Unified School District is at a high transmission level. This means that there are 100 or more COVID-19 cases per 100,000 persons, and the percentage of positive tests are 10% or higher. We can see a very similar trend in elementary school districts, with most in the substantial level, a few in moderate, and one with a high level, Toltec Elementary School District. And for the high school districts, both are at a substantial transmission spread. Our goal is to stop the spread of COVID-19, so all transmission levels are low. Please remember, these are examples only. You may have received an email or call from work or school about possible exposure to COVID-19 at one point throughout this year. This is known as contact tracing. The main goal of contact tracing is to avoid the spread of COVID-19 by notifying those who have been exposed to someone with COVID-19. The person who notifies you is called a contact tracer. After being notified, the contact tracer will recommend self-quarantine and that you monitor yourself or child for COVID-19 symptoms. The contact tracer may ask for any supportive services that can be provided during the quarantine period, as you should not leave your house during this time. They can send an at-home kit test to confirm diagnosis if anyone begins to experience symptoms. The contact tracer will ask for the name and contact information of people you have been in close contact with so they can be alerted of the exposure, quarantine, and get tested for COVID. This message will not reveal who is sick. What is close contact? Any person within 6 feet of an infected person for a cumulative total of 15 minutes over a 24-hour period, which begins 2 days before illness arrives. It is mandatory for schools to contact trace. This means that if you were in close contact with a person who tests positive for COVID-19, the school must provide the information to the local health department to initiate the contact tracing process. This means you will receive a call from a contact tracer. In 2020, there were 29,465 total confirmed cases reported to Pinal County Public Health. 3,444 of those confirmed cases were from Pinal County schools. In the graph below, we can see these COVID-19 cases separated by school grades. 52% of the cases were in high school students, 28% of the cases were in elementary school students, and 20% cases were in middle school students. The graph on the top left illustrates the COVID-19 cases by age in Pinal County. We can see a trend that the higher the grade level, the more COVID-19 cases. Why? One mitigation measure is cohorting. It is used in elementary schools for students to stay together with their own class, while in middle and high schools, the students move around from room to room and meet with different classmates. Also, higher grades have more after-school activities, like sporting events or clubs. And also, perhaps due to the less supervision and more socialization during lunch and recess at an after-school event where strict COVID-19 precautions may lax. In the next graph, we can see the comparisons of community cases in blue and school cases in red. The school cases are a percentage of the total cases. In the third graph, school cases are presented in green, and we can see the numbers of cases follow the community transmissions as a percentage of cases. Now back to contact tracing. In Pinal County, during 2020, 4,002 student contacts were placed in quarantine. There were 36 COVID outbreaks with 237 school age cases linked to those outbreaks. Now I will let Erin share some information about quarantine, isolation, and mitigation strategies.
Understanding quarantine versus isolation is a crucial concept to keep yourself and others healthy. What happens when a person is exposed to COVID-19 versus what happens when someone tests positive for COVID-19? If you have been exposed to COVID-19, then you should quarantine, but if you have tested positive for COVID-19, then you should self-isolate. During quarantine, continue to monitor your symptoms and check your temperature regularly. If a child or someone else not vaccinated was in contact with someone who has tested positive for COVID-19, stay at home for 14 days and do not have contact with others. It is important to quarantine so you don't spread COVID-19 to someone who is at high risk for severe illness without knowing, because you are spreading the disease 2 days before you even have symptoms. If you or a child tested positive for COVID-19, isolate yourself from others, even in your own home. Even if you don't have symptoms, you still need to isolate because you can still transmit the virus. You do not need to quarantine if you are fully vaccinated, which is 2 weeks after receiving your final vaccination dose. 14 days looks like a long time. How can I shorten my quarantine? To shorten your quarantine, you must meet all of the following criteria. You don't live in a congregate setting, you have remained asymptomatic, and you continue to monitor your symptoms for 14 days after your most recent COVID-19 exposure, and you follow all recommended CDC guidelines for 14 days after your most recent COVID-19 exposure. Again, you do not need to quarantine if you are fully vaccinated. Let's consider the 2 scenarios that can allow you or your child to shorten your quarantine period. The first is that if you or your child quarantine at home for a full 10 days since your last COVID exposure and no symptoms are reported during all 10 days, then you and your child can leave home on day 11. The second scenario is to quarantine at home for a full 7 days without symptoms. The person can then take a COVID-19 test on day 6 after your last known exposure to COVID-19. If the test results come back negative, meaning no COVID-19 detected, you can end your quarantine on day 8. It's important to note that if the quarantine person experiences symptoms consistent with COVID-19, then you and your child should self-isolate, seek a healthcare provider for a COVID-19 test, and follow CDC COVID-19 guidelines if you or your child test positive. Quarantine and isolation release guidelines can be confusing, so let's go over some scenarios. This is especially important since the vaccine is still not available for children under 16, and we want to stop the spread of COVID. Quarantine and isolation release guidelines can be confusing, so let's go over some scenarios. This is especially important since the vaccine is still not available for children under 16, and we want to stop the spread of COVID. If your child is asymptomatic and tests positive for COVID-19, the child must stay at home and isolate until 10 days have passed since specimen collection of the first positive test while asymptomatic. If your child is asymptomatic and tests positive for COVID-19 by serology, which is an antibody test, no isolation is required because there is a low likelihood of active infection. It is still recommended to take precaution to avoid further spread. If your child is asymptomatic and tests negative for COVID-19, then no isolation is required, but still take precautions to avoid spread. If your child is symptomatic and waiting for COVID-19 results, quarantine until you have received the test results. If your child is symptomatic and tests positive for COVID-19, then stay at home and isolate for 10 days since symptoms onset. If your child is symptomatic and negative for COVID-19, stay at home and isolate until at least 24 hours has passed since fever, without the use of medication that reduces fever, and other symptoms have improved. Mitigation strategies are critical to avoid the spread of COVID-19 in schools. Hybrid courses are an important strategy. Hybrid is a mix of online and in-person classes. By splitting the group of students in half, one half online and the other half in person, more room is available for physical distancing. Desks should be separated by 6 feet, 3 feet in elementary schools if students are fully masked, to allow for physical distancing. Face covering should be required for all students. Parents and teachers can work with children to help them follow these strategies on their own by sharing 3 simple phrases. We recommend the 3 W's: wear a mask, walk 6 feet apart, and wash your hands. Maintain physical distancing on the playground by determining the number of users who can physically distance 6 feet from one another or 3 feet when masking is rigorously enforced. Post accessible and visible playground signage in English, Spanish, and any other dominant language spoken in the community. Maintain equipment cleanliness by cleaning the playground frequently. Provide hand washing and sanitizing resources nearby, or have students bring their own sanitizers. It is crucial to train teachers, staff, and volunteers in these prevention steps to promote safety and healthy behaviors. Children thrive on socialization and play for their development, and by creating a safe environment, children can still participate in fun activities and stay safe from COVID. Now let's discuss how to clean and sanitize classrooms effectively. Disinfecting is key for a safe and healthy school environment. This graphic shows proper techniques and guidelines for disinfecting surfaces properly. To disinfect properly, start with pre-cleaning surfaces that are visibly dirty. This is because dirt and debris reduces the effectiveness of cleaning products. It is also important to check the label. The product should be labeled a disinfectant because certain products only kill bacteria and some viruses. Disinfectants kill bacteria, viruses, and other microbes. Another important item to check for is an EPA registration number. This number is on the cleaning labels and it will be in very small print. All disinfectants approved by the EPA will have this number. Use disinfectants only with this approved EPA number. Read the label and identify the disinfectant's contact time. Surface areas need to remain wet with a disinfectant for a certain amount of time, and contact time varies by product. If you don't leave the disinfectant on the product you're cleaning for the proper amount of time, it may not work. Special thanks to Dr. Kelly Reynolds with the College of Public Health for providing support for this graphic.
The pandemic is not over. So as a reminder, here are important guidelines to follow for the rest of the pandemic. Schools should continue to strictly implement the usage of masks. Adults should remain 6 feet apart. Students in elementary school should remain 3 feet apart. And students in middle school and high school should remain 3 feet apart in areas of low, moderate, or substantial community transmissions. In areas of high community transmissions, all students should remain 6 feet apart. Mask wearing should be strictly enforced if cohorting is not possible. Cohorting is defined as groups of students that are kept together with the same peers and staffs throughout the school day. Additionally, schools should consider the continuation of hybrid schools, universal mask wearing, and protocols for after holiday breaks, like moving classes online for the first 2 weeks of school in order to allow those who went out of state or were in social gatherings to quarantine for 14 days. COVID-19 vaccines are here, but they are not available for children under 16 yet. There are 3 vaccines currently offered in the United States: Moderna, Pfizer-BioNTech, and Johnson & Johnson, Janssen. Moderna is a 2-dose vaccine. Once you receive the first dose, you receive the second dose 28 days later. Pfizer-BioNTech is also a 2-dose vaccine, and you receive the second dose 21 days after your first dose. Johnson & Johnson Janssen vaccine is a 1-dose vaccine. The current age requirements for Moderna COVID-19 vaccines and Johnson & Johnson are 18 years or older. Pfizer-BioNTech current age requirement is 16 years or older. You are considered fully vaccinated 2 weeks after your last dose of the vaccine. Since these vaccines are not available for children yet, it is important that adults are vaccinated to stop the spread to children and to stop the further mutation from happening. Keep in mind that any vaccine you get is a good vaccine. While children under 16 can't get the vaccine, we in the public health encourage all folks eligible to get the vaccine as soon as possible. You can see some myths on this slide, and I'm going to talk about a few of them. The first one is, I got COVID-19 already, so I do not need the shot, which is false. You can still get COVID-19 even if you already had it. The second myth is getting vaccinated makes me immune for life, which is also false. The vaccines are still new, so we do not know how long they can protect you from the virus. Also, you cannot immediately stop wearing masks or taking precautions after getting vaccinated. We don't know how long the vaccine immunity will last, so it is important to keep up with COVID precautions. And there's no link between COVID-19 vaccines and infertility. The COVID-19 vaccine development was not rushed. All safety protocols were followed. So what happens after being vaccinated? You may experience a few side effects such as pain and swelling where you got injected, fever, chills, tiredness, and headaches. If you do have a fever, drink plenty of water and dress lightly. In order to reduce pain where you got the shot, apply a cool, wet cloth and exercise the arm. Creating mobility will reduce the soreness and pain from the arm. Some people do not experience side effects, but if you do, let the CDC know by downloading the app VSafe. After receiving the vaccine, continue to wear a mask, avoid crowds, maintain 6 feet from others, and wash your hands frequently. Make sure to schedule the second appointment if you got a vaccine that requires a second dose. Once you are fully vaccinated, you can gather indoors with fully vaccinated people without wearing a mask and gather indoors with unvaccinated people from one other household. Please consider those people who are at increased risk or live with someone at increased risk for severe illness from COVID-19. We must continue to take precaution around these individuals and continue to social distance around them. Thank you for listening today. If you have any questions, please visit Pinal County Health District website for more information.